Good afternoon. Coming to discuss the case study regarding Mr. Boyd. Mr. Boyd's admitting diagnosis is substance abuse. His assessment findings is that he's a 55-year-old male misusing alcohol and substance abuse intermittently for the past 20 years. His vitals, the blood pressure was 150/78. The temperature was 98.4 orally. His heart rate was 76. His respirations was 16. His oxygen saturation is 98% on room air. In the past 5 months, Mr. Boyd has increased in substance and alcohol abuse due to the loss of his spouse. He has had rehab in the past and detox and counseling as well. He demonstrates hand tremors and balance issues. He has no visits from family and abnormal lab results as well. His blood alcohol was greater than 300. Liver increased, albumin decreased, and also the patient states, I can get it under control. Client problem 1, abuse of alcohol and substance abuse. Client problem 1, intervention. Sent to long-term intensive rehabilitation center for intense substance abuse therapy for alcohol and substance abuse. Client 2, problem. Client grieving from the loss of his spouse with increased alcohol and substance abuse. Client 2, intervention. Provider has prescribed group therapy, but he can also benefit from individual therapy or counseling. Client 3, problem. Client problem 3. Client has no support outlet from family. And he has no support outlet. So client problem 3, intervention. The client can attend AA meetings weekly, also NA meetings for support of surrounding peers in a positive setting. Potential client outcomes is for the client, for Mr. Boyd, to be able to cope with grief daily. Client have a positive outlet from ongoing manifestations of substance or alcohol abuse or consumption. Client decreases alcohol consumption by 10 to 15% within the next 30 days. Client labs improve within a week. Blood alcohol less than 50 milligrams. Liver decrease and albumin within normal limits. This is the case study of Mr. Boyd.